Aloha and welcome to Be Fit for Health. This is Bianca, your host. It's another great day to celebrate our health and wellness. I just wanted to say thank you again for joining me and spending the next 55 minutes to an hour and talking about all good stuff when it comes to our bodies and what we can do to keep it and maintain it in a wellness point. So today's show is going to be fun because I'm bringing on Kelly Nash Montone. I know you guys know who she is. I brought her on before, and we've talked about the fabulous machine that she uses to help people become pain-free, the electroacuoscope. And you guys know I'm a big fan of it because I go see her as often as I can because of the fibromyalgia thing that I deal with. And fibromyalgia, if you guys don't know what that is, it's a widespread pain issue in the body, and it could be from the fascia, it could be from your central nervous system, it can be from your brain, it could be anything. So it's different for everybody, but sometimes you have these flare-ups, and flare-ups are not fun because it can cause inflammation in areas and cause pain and discomfort, and sometimes it can even give you a migraine. So with that being said, I just want to say welcome to Kelly. I want to have her introduce herself to you because her journey is special. What brought her to this point in Hawaii? She's originally from California. What she's doing in Hawaii and why she's doing this particular type of modality when it comes to helping us ease our pain. And what successes has she achieved for her own personal body? I mean, she uses this stuff on herself as well. So Kelly, welcome to my show.
Thank you very much for having me.
I just said welcome back.
Thank you. I am honored. It's a pleasure to talk about what I'm doing. I feel I am following my purpose, which is passion about life, all life, human life, animals, creatures. I've always been drawn to helping and bringing out the best in others, and that really enlightens me to be my best self. And I was introduced to this instrument of harmony with some broken bones that I had, and John Thorpe happened to be in California at that time. I was young, and he had moved from Hawaii back to California and could help heal my bone injuries, and I was able to be stronger and fitter, and the healing vibrations of the electroacuoscope are felt immediately. You can feel that difference happening right away, and there's nothing that compares to that healing. Your body sometimes can take so long to heal, and maybe it won't heal appropriately if you don't have those right tools or intuition or guidance, really. And so I'm here in Hawaii. I went through the certification through the Thorpe Institute in 2013.
Okay.
And was able to have an instrument to practice with. It's an older technology. It was the Ocuscope, which works just on the nerves. Somebody had found one in their house here from a long time ago, and they said, found the phone number of the Thorpe Institute on the instrument, and they said, I don't know what this thing is, but I found it in the house that we're selling now. We're clearing it all out. And
wow, somebody actually had it here.
So that one actually had battery. I was able to charge it, and I could continue to heal myself and practice it and just know a little bit. And with my savings, got a electroacuoscope, this new technology, which is 4 times faster and has 2 instruments inside of one. So we can have the connective tissues on mode 2, and we have that central nervous system that we can really get into the body and see the communication system.
That's really interesting. So the technology is 4 times faster than the old one that you started out with. So from what you were explaining to me the other day too, is that the NASA technology that John Thorpe partnered up with to develop this newer technology. Now, if you say it's from NASA, are you talking like what, more pinpoint?
It is very precise. Imagine if you launch a missile from point A and you want it to go to point B, and it can take curve spins and loop around. I don't really know. I'm not that.
You're not a scientist.
I'm not the magician or the scientist. That's what those are called. But the machine itself does that. It precisely searches and seeks for abnormalities for the cell pattern, and it's going to correct and correct until they're holding their charge that is normal, which is healthy.
Okay. So so if you think about missiles, you think about electrical currencies, and you're talking about computer like level information sending and receiving.
Right. Our bodies are like big computers.
Right.
And it needs to be computing, and you also need to charge your computer. You need to get all those circuits wired appropriately so that it can be fully functional.
Yeah, it flows. So that's
you
really
need to
interesting.
update your software. Basically, they updated this software.
I wish I could.
And have this new state-of-the-art technology that's really here to enhance and accelerate the body's cell potential.
I really feel like this is the beginning stages of what I always feel like is sci-fi. You know, when you think about you walk into a machine and it gives you brand new spine, it gives you a brand new brain, it gives you a brand new heart. Like, you know how your body just becomes renewed, like as if brand new, everything spanking new. This is kind of like in that startup technology. I feel like we're in that process of energy medicine where if you're putting in NASA technology into a machine for medical reasons, and it's being very specific to controlling the energy function of the nervous system and the cellular function, this is amazing technology. I don't think people understand how this is a big deal, because if it's in a machine that's the size of a suitcase, this is small. And I have a feeling in the next 20 years, that suitcase is going to be like a size of an iPhone.
Well, it's great because it is very protected. That suitcase, the case that it comes in, and all of that computer technology stuff you're talking about is protected with and has the spacers and microprocessors and everything so that it can be carried from place to place,
right.
So it can be set up and protected or traveled with. I've traveled to Europe to help my sister-in-law heal after surgery. It's not over in Spain yet, so
right.
So taking that technology across some borders to really influence healing and doing my best to follow John Thorpe in his pioneership, because I do strongly believe in this instrument, the potential that it has to enhance our ability as humans, and with all of the electricity that vibrates around us, we need to make sure that we're balancing, harmonizing, and
right.
and getting the good sources.
People don't understand that, you know, and it's okay because you're not medical doctors, nor have you studied this in school like I have or Kelly has. The idea behind the human body is we're energy, right? Everything flows, everything goes, but then you have stagnation. And stagnation, I'm sure you've heard from your massage therapist or your acupuncturist. Stagnation is when the flow and qi in Chinese medicine they talk about doesn't move anymore, and it collects in a place where it could be toxic, or it can be almost like a congestion, like a freeway when you have traffic and things like that. So this type of machine, basically what it does, from what I understand, because I did a lot of homework on this before this interview, because I don't want to sound, you know, ignorant. I want to sound smart, right? I'm starting to start smart, right? I'm not, okay, good. So I'm getting approval first before I go on. So basically what I understand is this machine basically allows the flow. So it opens up that traffic so that your car is able to pass through without having to sit there and wait, because then your engine overflows, you have carbon monoxide and all that toxin starts spewing into your car, and it's just not healthy. Same thing with your body. When you have that toxin in that stagnated force, it causes all sorts of havoc, right? Some of the ailments can be what? You can feel like you have the flu. You can feel like you're coming down with a major headache, all these other things. So when you have pain, which is the source of what drives us to go to the doctor, right? It's a signal.
A red signal.
Right.
Hold on.
We go to you.
Tune in.
You get that machine. You measure, because she's done this to me, guys. I'm saying this from experience. She measures you to see whether or not that flow is there or not.
Or how resistant it is.
Right.
Maybe there's a little bit of something, but you need some help. We're going to stimulate that and start to encourage that flow.
Yeah.
And slowly break through, right. Open the pathway,
right.
And get that flow so your body can absorb the healing properties of your own body.
Yeah, because our bodies can heal itself if it's given the right tools.
Right. And if there's a blockage, let's say there's, you know, the river and it's heading towards this way and it's just gathering water, It becomes that stagnant water until a rock gets pushed out of the way, it can flow again.
Right.
And where our blood is flowing, that energy source, we can start healing different places, different parts of the body that was getting pain caused, or
if there's inflammation, you're bringing down the inflammation enough, basically, so that the body doesn't have stress,
right,
and the proper hormones are in place, and the negative hormones are being suppressed. So, and I think you guys understand that when there's stress in the body and there's inflammation in the body, your cortisol hormone gets produced, and there are signals that occur in the brain that allows the body to either heal or not heal. And when you're in fight or flight, which is my system, and poor Kelly has to deal with this all the time when I go in, she has to sit there and think about, okay, what should I do with her and where should I put her? Because sometimes when she opens me up, it goes back to shutting down again, because it's been a pattern of shutting down for a long time. So she has to open me up, hope that it sticks. She goes back at the end of the session with me to see whether or not it stayed open. And then she'll be like, nah, we're not quite at the numbers that we need to be at. We need to stimulate you some more, because your body needs that memory of where it should be. And a lot of the times, I gotta tell you, I walk out of there going, oh, thank God, because I'm in so much pain. I was like, or I have so much discomfort. It's like speaking the same language, right? I was speaking two different languages. Now I'm speaking the same language, and my body's flowing the way it should. And that takes the technology to do that. And you're thinking, how does that work? Because your body is enclosed, right? You've got the skin covering the muscles, and the muscles with the tissues, with the connective tissues. How is that happening? How is it without injecting something into the body or taking a pill, or without having that? How does this work? It's currency. Because our nervous system is energy, she's feeding and communicating through energy. So it's working through the frequencies that she used. So let's talk a little bit about the frequency, Kelly, because people are going, what's she talking about, frequency, energy? What does this mean? What are the frequencies? What are they exactly?
I would love to talk about the frequencies. I'm going to take one little mini step backwards, because it is a current, and this is a very small current. It's called a pico current.
Okay.
Which means it's a trillionth of an ampere. It's very small. It's not a microcurrent. It's not a millionth of an ampere. It's a trillionth. Where our cell membranes, that's the information, the communication system that our cell membrane will open. It has a sensitive gate that says, I'm either closed off and I'm protecting myself, whether it's damaged or whether it's a healthy cell. The trillionth of an ampere allows the cell membrane gate to open and absorb the nutrients, that food you're talking about. Give me that good energy to recharge that cell. And that's a big difference in this instrument, and that creating the harmony.
Okay.
The frequencies then are actually taken in. So we're not just stimulating these frequencies through, we're actually knowing that the cell is absorbing these charges.
Okay.
That memory you're talking about. So we're reminding the cell, here's this delta frequency, a 0.5, that is a very sedative when you're in the deepest rest, deepest sleep, where your body restores. Many of us don't get there.
Right.
We're in this, kind of half sleep. We wake up, we're,
Right.
overstimulated, and it's hard to shut off. So sometimes drugs are involved, and well, this is a drug-free system.
Right.
Where we're using the energy to retrain that connection, those balances. So the delta is a great place to start, and it is the best place to start.
It's my favorite spot. I like to go there all the time.
And it's a very wide range, so we can kind of harmoniously wake things up, let it know where the body's at, and the body wants to be restored then, because it's reminding, because you're in a rest state.
And that's where all the healing happens anyway, when you're calm.
It can begin there.
Yeah.
And that's the first frequency as the widest range. And then we have the theta that I was going into with that REM cycle, that rapid eye movement, where you're in a dream state, and that healing can happen. And going further, if the body allows, to go into a higher, 5 hertz to 8 to 10, where we can really get that inward awareness, that alpha frequency, that meditative state, that we call it the runner's high.
Right.
And it's very healing if the body's ready for it.
Right.
the best thing about this instrument is for everybody.
Right, it
It's
is.
for anybody.
Right,
And it's very patient
right. Specific.
Specific.
I know, it sounds like me. I can't say that two words together. God help me.
Try it 10 times.
I know I can't.
Patient specific. So it depends on that body.
Right.
And that's the greatest thing. And I get surprised all the time, and I welcome new cases and challenges. And only the machine's going to communicate. You know what? This person did great from delta to theta, and as soon as I get to the alpha, it's like, oh, it's a little too much for me. It's a little too fast.
Because it shows it on the machine through lighting, right? There's like lights that light up,
lights,
and then there's numbers.
Actually the biofeedback system that lets us know, look, you're holding clear charge. Today our read, because the instrument actually will detect and fine-tune itself to the energies around it.
Okay.
And will tell me, this is our clear state today. This is what perfect looks like. Okay, I'm heading for 107, I want the body holding there.
Right.
And so if I first measure you and you're like 2.
Right, which I sometimes am.
We need to charge and recharge that cell, and there's no point in getting to a higher frequency if at that delta, your body's like, okay, I'm 47. It's okay, recharge you. Let's get you to the 107.
Yeah.
And get that body. So the biofeedback system lets us know that's the purity of the system. We can still measure that resistance. Okay, there's still some resistance. You're not holding on to that charge.
Right.
That ATP needs to be reinforced and
Right.
reminded that it can be healthy. Calm that system back down, and we can move forward.
That's the biggest challenge with a lot of people that have certain ailments, and we're going to take a quick break, and when we come back we'll talk more about them. But I just want to say the challenges are going to be, how do you get your body out of the sympathetic state to the autonomic state, which is the healthy part of our body. The sympathetic is your fight or flight. So let's take a quick break. It's going to be about 45 seconds, and when we come back we'll get right into that. Cool. You need to redo that.
We're just on a quick commercial break. It's actually my commercial. Your microcurrent electrotoxicologist.
Okay guys, we're back with Kelly Nash Montone with the electroecoscope. We're talking about energy medicine, and basically we've gotten into a little bit about what the frequencies are that she uses when it comes to this particular machine. And the reason why that it's so great is they use the NASA technology, which means that it's missile level technology, where it's so specific, where if you have a specific point in your body where it's not flowing, it's stagnant, and you need to open that up so that you're not inflamed and you're not having this pain reaction, and there's proper communication going on from the brain, the central nervous system, to the body part. This machine basically helps guide, almost like it's like a guide. It's like a tour guide guy saying, listen, this is the best route, go, this flow, let's open up, let's get to that destination faster, because this part's stagnant, let's work on it on our own. And it may take 1 or 2 sessions, it may take 6 sessions, we're not sure, but it all depends on your body. And I was just talking to Kelly before we went on a really quick break as to, she was talking about the delta, theta, alpha frequencies, and how they all have their different therapies and what they do for the body. Some of us, like myself, get stuck at delta because I'm so wired.
In beta.
And beta.
You're there all the time.
I'm in beta all the time, man. As you can tell, I talk fast, right? And so the intensity of the brain that I have is just nonstop, and it just doesn't shut off. So I talk like this when I get to her office. She lays me down, she puts me on the delta frequency, and all of a sudden I'm like yawning every 2 seconds. She starts laughing because I'm like, yeah, man, I needed that. I needed my delta so bad because beta was controlling me way too much. But I know this. It takes quite a bit of an effort for me in a long-term effect, because once I leave you, I'm good. But then stuff happens, stress happens, so I'm stuck in sympathetic. And I'm trying to figure out other ways besides you telling me to breathe and do my yoga like stretches. And trust me, she sends me home with homework. I know, she sends me with homework every single time. And she scolds me like a mom. Like, you're not doing your stretches. But no, it's true. But the machine itself tries to get me to a place of autonomic, neutral, balance, flow. So how do you help those individuals who are more of a sympathetic body than they are an autonomic system? How do you get them to the place of, besides putting them in delta, what points do you use? What part of the body do you manipulate? How do you get to the brain, first of all? Because that's where the brain, is the key to all this.
The brain, our stomach brain, every brain, we can work off the different acupuncture points, acupressure points, and I really find that conjunction with breath, with sound, with everything that goes on in the therapy room, but really the instrument helps in those frequencies get that transition process started to remember how to flow. A lot of times it is those adrenals that are overworked, so we can work directly to that. Some meditations are directly just to the frontal lobe, and like I said before, it is definitely patient
specific.
One day I'll get it.
It's okay.
I was even practicing in the
That's your word for today. That's your word for today. That's your word that you can't.
I think I just need to go get in the water.
I
need to go get that alpha and get my grounding on.
That's okay. I had mine. It was coffee.
Patient specific. And depending on each client that I work with, it is different. Maybe it is just bilateral hands and feet. Maybe it is a plate to the C1, to the governing vessel. It just depends for each person. And that is with experience, that is using a lot of the knowledge that I've gained with the Chinese acupuncture. I love to incorporate a lot of the Ayurveda I have learned. All of it really ties in to a very long history. Same with electromedicine, has been around a very long time.
Oh yeah, since the ancient Egyptians?
Correct.
Yeah.
And just we're always adapting. And you know what? We're right now in 2020. It's a new age, and we've never been here before. And I think all of the philosophies to really come together and work as a conjunction really benefit each patient.
I think at the end of the day, if you're able to get to the frequencies of the brain, because the brain is all frequency too. It's all neurological. There's so many things happening at the same time. You've got the GABA in there, you've got dopamine in there, you've got all these things, and you've got to figure out a way to. And the Chinese did this so brilliantly 3,000-4,000 years ago when it came to the way that they worked the human body without even having X-rays, without having really those types of technology. They understood that there are things that if you touch, let's say, your thumb, the point between your thumb and your index finger, and you press on it, it actually stimulates, if you have a headache, it stimulates it to calm down.
Master points.
They came up with it, brilliant. And we use it to this day to help our bodies balance out.
And how interesting is that? A large intestine 4, it helps your headache, but that's where in your body, in your stomach. How's that working? It's in your hand. Yeah, how we all flow. We're this huge circuit, this huge computer system again with these energy channels that need to be rewired. Those neurological pathways. Name them. There's a lot of names.
Obviously.
And it is all connected. And sometimes one is, dysfunctioning. We have disease. Your body's communicating that. How do you take care of it? Sooner the better is my thought. And
so let's talk about some ailments then, since we're talking about how to correct something. So if somebody has, the obvious is if you injured yourself, obviously there's inflammation. So this machine obviously helps with pain. So how do you help someone who, let's say, has diabetes, or somebody who has a heart issue? Does this machine help with that too?
It does.
Okay, how does that work?
Because we're helping the body heal itself by itself.
Okay.
Depends on those ailments. Say the diabetes is in their feet, they're losing, circulation. What we're doing, breaking through, we're making circulation happen again. We're re-educating those pathways that once were healthy, but through time have gotten damaged, have
a lack of flow, lack of
and we want to reinforce that balance, reinforce that harmony, and break through those challenges. And of course, with some help and aid and suggestions of diet, how we feed and fuel that body, how we circulate, educate, and electrify. You know, we get so de-electrified and we have right? so much chaos, and we're bombarded that we do need to retract, and sometimes less is more.
Well, with me especially, so I have PVCs, which is a cardiovascular irregular beat thing. My heart's in great shape, but it's just that it doesn't have a good wiring. So
and remember, you were getting pain referral down your wrist. You were saying that this was going that, and just by working heart points some of those points.
So you were to control that irregular heartbeat. So you brought it down from, let's say, 15% of regular beats to down to maybe say 8. You know, and that made a difference for me to be able to function better. IBS. I mean, if you have irritable bowel syndrome, I mean, it could be bacteria, it could be microbes, but it could also be neurological in the sense that we do have neurotransmitters in our small intestines and our gut. So that makes sense to use. So basically, this machine is such a great invention that it touches everything. As long as you have a nervous system, your body needs to use this machine, because there will be miscommunications. I mean, we're only human. Our body will, at some point, have a miscommunication or dysfunction. It's great to know that there's a machine that puts you back into, like a mechanic. You kind of put you back in place.
Yes.
That's crazy.
Exactly. And we can talk about hydrating, and we can talk about those things, but this does re-energize and give, I like to use that analogy as juice to those bodies, because
jumpstart your car, jumpstart your body.
Yeah, it needs that fuel, and it cannot drive away with, I mean, unless you're an electrical car, but what are you doing? You're plugging it in. So we're just a body that we can go plug in. We're these living creatures that deserve an optimal functioning life, and a life of less suffering, and that's my mission, and I want to encourage everybody to give it a try. It is a no harm, a very subtle.
Yeah, there's no really cons, except if your body's really toxic, you might feel a little sickly afterwards, just because you've got a lot of toxic load in your system. Yeah, so I mean, I've had that experience, guys, and it's not a fun feeling, but it's not a bad feeling. It's not like you're gonna die. It's just that your body's saying, guess what? You've been storing a lot of stuff in your body. We need to get it out somehow.
We just released it. You need to continue to see and follow protocol, so we can help your body process that a lot faster.
Yeah.
We can
drink a lot of water.
Drinking a lot of water and resting. You know, go back to that. A lot of people sometimes are really tired after a session. Why? Because their body's still in the healing state.
Yeah.
So I allow that, give some insight. And on the other note, 90% have that extra energy, feel better, and everything's really cooking. I said, be careful.
Yeah, because you can
now you can overdo it. That elbow that wasn't functioning now feels great. Don't go lift 400 pounds.
Yeah, don't work out. No, but the Chinese medicine says the same thing. After you do an acupuncture session, they say don't work out, don't drink coffee, eat hot food, not cold food, and not to have extracurricular activities, meaning, you know. But that's because your body needs to hold on to whatever it has in order for it to continue the healing process. So this is like electrical acupuncture, in the sense that it's very specific, so you got to follow that protocol.
Just this week I had a couple clients telling me that it was very similar and way different.
Yeah.
That this is, you know, where acupuncture is going these days, because it works and it's charging up on a faster level. Everyone wants to accelerate the healing process, you know, and sometimes it isn't easy. Sometimes it does take a while. But look, your body didn't get this way overnight. This chronic infection, or however way you went around it and not straight to the direct issue, maybe will take longer for your body to re-educate and process the toxins, as you're saying, and that detoxification process. Again, patient specific, and to and through, and the feedback that I got was this was a more precise And that I'm just going to go back to those Pico currents and what sets this instrument apart.
Yeah.
The electroexoscope.
Because you're not guessing.
Then-
you're being very specific based on what the machine is saying because my body and your body are different. So my numbers are going to come out to be different than your numbers, and you're going to do a different frequency for your body than my frequency, and that's why it's so specific. I think if people were to come in and do a session with you, they would see that you've got plates on them, and you've got a probe, and you're measuring things constantly. You're constantly looking to see if it's actually flowing, if it's still stuck after a few slide throughs.
Or what people say, it's moving over here. Sometimes the pain wants to run away and hide.
I got those runaways.
Yeah, so
those
let's go
are fun.
get it. Let's go after it. And it's always a great, information too to communicate and really get to the point, because it will happen. Or if it is something acute that did just happen, and in that session you're like, oh, it's achy, it's starting to feel, it's going through its natural process just a little faster.
I find it interesting that when you're working on a point in my body, that I'll start feeling it either in my lower abdomen, but you're somewhere up on the top, or I'll feel it if you're working on the bottom, I'm feeling it on the top, and I'm like, what is going on? Why is this hurting up here? As there's no correlation. But if you think about the meridians, right? Yeah, the Chinese meridians, that makes sense. So if you're working on the stomach channels, there are stomach channels in my head,
and in your leg, where it's up and down and
it's
crossways, and that's the beauty of being an electrical being, and the phenomenal about being so unique and special, and getting that precise. It isn't a one size fits all. It is a one size fits all, but there's specific protocols to follow. But you may have an intensity that your body tolerates only 25. Or not getting to the alpha yet. Maybe one day, someday, this lifetime, who knows? But it's helping you feel better. It's helping you process. It's helping those connections happen. So maybe where things have been shut down a little bit, it's like, oh, there I am. There's my other half, or that's where I need to be flowing to and through.
Right. I'm able to talk more about this with you since from the beginning show that you and I did way back when in April to where I am now and understanding the machine. It's a huge difference, because I think you and I both grown together with my body as far as what we can and can't do yet, and I think my body is starting to communicate better to us as far as letting us know.
And you like to do your own homeworks and and push your body too in different ways and try new things. That's, I think, is really admirable, you taking your health in your own hands.
Yeah.
And I am here to support you through that. Of course, I'm always going to say, let's get the protocol, let's get 3 in, let's really educate your body, and you're listening to your body, and I think that's phenomenal. And
I'm also smart. I listen to you too, so you got to listen to your practitioners, people. This isn't their. Yes, everybody needs to make a living and everything else, but when it comes to certain people like Kelly and myself, when we have clients, it's a matter of getting them the results, and it's a matter of following protocol. Because if you miss a step in the certain things that you do, you're going to miss that step in healing, or you miss that step in getting your body into shape, or miss that step in getting your body nutrients that it needs, because there are things like in everything in life, there are steps you need to take, and there's professors that help you get there. So Kelly is one of those professors when it comes to electroexoscope. She knows what she's doing. She tells you to do 3 sessions at once. Do 3 sessions at once, because that means there's a reason for it. So the reason why you had initial clients do 3 back-to-back is because why?
For result-driven expectations. We're really re-educating those pathways. We want those cells to hold their charge.
That's right.
And going back to when you were saying acupuncture, they don't want you to do anything for a little bit. I, working with the electroexoscope, know that the charges are still effective when you leave me for 24 to 48 hours. And so if you're learning something or relearning it, you do it again. You're not going to get 6-pack abs by doing 30 sit-ups on Monday. And then you go back on Monday and you do 30 sit-ups again, and the following Monday you're not going to get 6-packs that way. Trust me. No. You need to work them from all angles. So that's what we do. We go local to direct, and a systemic detox. And that's following a protocol, and it will be probes, plates, like you mentioned, and we want to know that those cells are holding their charge.
Yeah.
And where they stand, and
Right.
we can tell, okay, there's a lot of damage. You fell all the way out again within 24 hours. Okay, we're gonna really re-educate them again, and we can start the process of what it's gonna look like for you. Is it 36 sessions? Is it 12 sessions?
Right.
Kind of go with how your
Your
cells
body
are
responds.
responding, and we can set up a program patient specific
Right.
to each and every
That's
one.
going to be the word for everybody to use now because you keep saying that. It's so funny. No, but you know what? The way I'm looking at it is this. Just like in exercise, I thought it was 21 days to achieving a good habit. Apparently, I was corrected by Dr. Tolley, who was on here, the behavioral psychologist. He said it's 66 days to developing a pattern.
Okay.
This is actual from a true doctor. So 66 days.
Patient specific.
Okay, especially don't do that.
66.
66, man. But no, but what you're saying makes sense though, because with exercise, your body will only remember what it can remember. But if you keep doing the same thing, it will start thinking, oh, this is what my new norm should be. Because what I had before wasn't working. So this is the normal, because the brain's the same thing. It has to have a certain amount of repetition to encode and make it a pattern for the body to follow. It's called neural pathways. So you're creating new neural pathways by having them come see you 3 times in that first initial week. Now that makes sense to me. I kind of feel like I'm going to take it a next step further, especially with me. You and I have been doing this for a period of time. I think every so often we should be doing 3 sessions, because I think the body, although you are teaching it every week, there are some things that needs an intensity, like an intensity of 3 days, so that your body goes, oh, yeah, I thought I was doing this right, but I really wasn't. I really just got corrected,
Right.
you know? So I think maybe every 3 months, or maybe whatever should be you should have 3 sessions in a row.
Honestly, yes, every week would be best for you.
Yeah, well, for me, yes. We're gonna do a GoFundMe for Bianca. Okay, she needs to go see Kelly at least 3 times a week. Okay, truly, but it is true. I mean, my body types, people with body types like me who have sympathetic nervous system that is in charge, needs to be taught.
And finding that right conjunction, you know, if there's the breath work involved and the accountability and manipulating each day in, day out in the programs and finding exactly those tunes for your harmony.
Yeah.
That's the cool thing.
Yeah, the body
in this life, that there are so many professionals out there to get in touch with and find that nice mesh to support your body.
I think it's really interesting. Is there any updates from John Thorpe's Institute that's going to be happening with this company? I mean, with this machine, is there anything that John is working on that may be taking this to the next level anytime soon?
Always. I do know that there is, really talking about the neural pathways, there is an awesome brain instrument that unfortunately the U.S. has not approved yet.
Okay.
But it is in some other countries, and they're going forward with that for healing.
Oh.
And
I
haven't used it yet, so I
Okay.
can't express my experience. And yeah, we should give him a call and see.
Oh, we should get him on. Yeah,
But
see what that is.
they're always marching forward and learning more and opening new research centers, because right now the contraindications are any pacemakers, mathematical type of battery packs that people are carrying around in their bodies now, because we are reading mathematically the pathologies in the body will throw our numbers off. So we wouldn't get a correct
information
feedback system.
Yeah.
I mean, possibly we could, anyways, saying it's a contraindication. Pregnancy as well, just because there's not enough science around it.
Right.
And yeah, opening up. I know there's a lot of grants out there right now for muscular regenerations and approaching it in different ways to get, they have a lot of science back already, and hours, thousands of hours and practitioners and clinical studies with this device. That is why we have more than handfuls of doctors on boards across the nation. So That being said, there's
That's
there's
crazy.
hope with the scope, and the Equiscope is out there. Reach out. There's technicians across the nation, doctors that are
utilizing this. Well, let's take a really quick break again, and when we come back, let's talk about the types of doctors that are utilizing this and what we can do here in Hawaii and get this machine maybe in some certain types of offices
That'd be
to
great.
see what we can do there. Let's take a quick break. Don't go anywhere, guys.
You guys like it? We're on a commercial break. Thanks for listening. I'll answer all your questions later. If you have any questions, leave them in the comments. I'll get back to them later. What's up, Deanna? Kellystime.
All right, we're back with Kelly Nash Montone. We've been talking about energy medicine with the electroequioscope, and we're talking about what it does and how it helps with pain, how it helps with, getting your body back into balance, helping your body communicate properly when it comes to the nervous system, and also, helping your body, do what it's supposed to do when it comes to other ailments. If you have diabetes or, other types of heart issues, it does help everybody. And it helps children. It helps. Actually, we didn't even talk about this. It even helps animals, because animals have nerves too. I mean, they're a living being. They have things going on. So this is for everyone, guys. And we're just dabbing into what the technology and where it's going in the next couple of years. I know Kelly mentioned that it is not FDA approved yet when it comes to utilizing this for the brain. There's something that they're doing extra for. I mean,
It's a different system.
Yeah, different system. Yeah.
This is FDA approved. It's a class 2 medical device that will enhance any practitioner, doctor, licensed healthcare provider. So if you're any of those, or if you know any of those type of people that are interested in no harm health, that want
Non-pharmaceutical. Yeah.
no drug,
Yeah.
and it is electricity to re-electrify any cells that have lost some of that charge or are
Your juice.
deficient, or yes, the juice. And so if you're suffering, or anyone that's suffering, whether it's mental, whether it's emotional, this system really does recalibrate the body's ability to circulate and process and be more optimal.
So when you say class 2 device, what does that mean? Is it because I'm not a medical doctor, and I know you're not either, but
I'm not.
I know you're told what the level of qualification is. So I'm assuming class 1 devices are things that are used in hospitals, like surgeries and things like that. So this is probably outpatient, is what I'm gathering from what I recall class 2 being. Yeah.
Okay.
So this means that most practitioners that are working in a clinical setting can use this in every sense. So if you're a massage therapist, if you're an acupuncturist, if you're working at a chiropractor's office, if you're working at a IV therapy place, even let's say plastic surgery place, it doesn't matter. This device can be used. And so I have a list of doctors that are using this machine, and they're from Arizona, San Diego, Las Vegas. They're DOs, MDs. I had Richard Delaney here, Dr. Richard Delaney, who was a 4-time board certified doctor in internal medicine, cardiovascular, you name it. He does this. He's actually opened up a clinic out in Boston, Massachusetts. But not Boston, but Massachusetts. And he's actually done a wellness clinic. So this guy is not only a certified medical doctor 4 times, he's actually even opened up a wellness clinic to utilize hydrobarics. He's doing this electroequioscope. He's doing it for red light therapy. He's doing all sorts of stuff because he understands that Western medicine isn't always enough. You have to use it but you can use other things along with it to enhance the body flow. So, I mean, these doctors are incredible. I mean, I have a list of at least 20 doctors in front of me, which I know you guys have more, utilizing this. So what can we do here in Hawaii to get these guys to call you, to get this machine in there so that you're the lonely person here that's doing it. You can't take care of all of us. So we need to get this machine in offices. What do we do?
Being places like this and Instagram has been helping me a lot. I'm on a live feed for my first time, really.
Yay!
And knowledge is power. Spreading the word of mouth. I'm doing a 2020 promo for 20-minute meditations. Reach out, call me. Setting up protocols with a great. If you hear it on mention Be Fit for Health. Reach out to me. We have great promos. If you know a doctor, we can do demonstrations there. Any doctors listening, I'd love to give you a protocol. If you just want your adrenals or the meditation or to work with your most chronic clients.
Yeah, give them to you.
Let me show you how we can work in conjunction. Let's marry the systems and get the people, the community, the members of, in our society that are suffering. Let's end the suffering together and see what we can do and magnify the healing. And
because not everybody can do drugs. Not everybody can take medications.
You know what? If the drugs worked, we would be a healthier community already, right?
I know. So, I mean, I can't take medication. That's why I'm grateful for you. I mean, that your treatments are basically taking the place for me in some of the medications. I mean, I'll take Tylenol once in a while, but it's toxic. I already have a toxic load. I don't need to add more. But sometimes you need those medications, and it's great if
right,
you
for
need
emergencies.
Them. Right.
I highly agree, and for transition times, whatever it is for each client, for each person, for each of these beings that we're speaking of, or in search of
something that's other than the
help
traditional,
and support. I would love for this instrument to be in
all
every single,
office,
studio, clinic,
as an option,
as a pre-op. Let's
for surgery,
let's get the tissues healthy
after
first.
surgery,
Let's enhance those tissues so that when they come out of the surgery, they can repair faster by using this as well. But there's not so much trauma for those tissues, and I think there are some studies on YouTube. I can try to link you up with that to put in your show notes for your listeners. There are really cool studies of how even surgeons can tell the difference of who had therapy first.
Right.
And after.
Well, you've had clients where their physical therapists were dumbfounded by the fact that the person had shoulder surgery and they're healed so quickly, and they're doing these therapies that people would do 4 weeks ahead of schedule.
So let's work together. Let's have everybody getting those results.
Oh my gosh, that'd be incredible. Yeah, I'm grateful, Kelly. I mean, this has been, again, I always say the godsend when it comes to the way that we met. It's like, you came into my office, literally walked in, where I'm like going, wow, I should have wished for $1 million.
The
maybe.
First set of eyes that have ever looked at me like, I know what you're talking about. Everyone else is like, yeah, I know microcurrent. No, this isn't microcurrent. It is under the umbrella with our codes that we use for medical billing. Right. Because the Pico currents aren't there yet, and all of the systems, and you were the first person, and I go knocking, I go, cold calling, and everyone doesn't know it, and I say, it's an electroequiscope. Like, I know it, I want it, how do I get it? And then we can set up how to to more communicate this, and that really helped to sharing with your trainers how it works.
It was insane. I think I sent a lot of my trainers to you, and I sent their people to you because of the response that we got. All I can say is this, guys, give it a try. And see if this is something that what I'm saying is for real. I mean, I think by now you guys respect me and trust what I'm saying is to be the truth. But all I can say is this: for me, it helped. It helps me. Look, it doesn't cure me, but it does help me live an existence which is very functional and very happy. Because if it wasn't for this, I would probably be taking medication for certain things, and I don't want to do that yet. I'm still young enough where I think I can recover fast enough.
Yeah,
and
we're reteaching your system how you can control it yourself.
Right.
Because ultimately, I don't want you in my office for the rest of your life.
No, you don't want to see me every day? Oh, man.
I don't mind seeing you every
I-
day, but I don't need to have you connected to the instrument for your suffering, you know?
It does feel good though. I mean, the
Yes.
Delta thing is like a drug, man. I'm like, going, ooh, this feels great.
So we're helping your body transition. At the same time, you know, I want, I don't want you there forever.
Okay.
I want you
Yeah.
better,
Yeah.
optimal functioning on your own, and you getting control
Wouldn't
of
that be great
that
if our
system.
body actually
So-
functioned perfectly?
It's highly possible, and
Yeah.
we can. We have
I'm
the
telling
ability when we treat it right, and when we can gather that
Well, I'm
information.
gonna keep up with John Thorpe as well. I think the next time I bring you on, I want him on to kind of give us an update as to where it's going. He doesn't have to be on the show for too long. He can just kind of say, "Yep, this is what we're doing. All right, see you guys later. Bye." Because I think it's going to be great for us to know where this is going to go. Because I know the last time I talked to him, he said that they're working on some stuff. I didn't know what it was towards the brain, but it is exciting to know that he's going to take that machine to the next level.
Right.
I think that's going to be exciting, and I'm curious to see how big that suitcase is going to look after they're done. I don't know. It seems to be getting smaller and smaller. So I'm just, technology is just so. You're talking about Pico currency. I'm talking about Pico technology. I don't know, but I just want to know, how can these people get a hold of you? What is the best way for them to contact you? Website?
Well, I have a website. You can phone call me or text me at 808-485-9697. I'm on Instagram as Kellystime. I am your microcurrent electrotoxicologist. You can find me on Facebook or microcurrentelectrotoxicologist.com.
Or you guys can look it up on my website. I have her icon on there on the website, Be Fit for Health with the number 4, so Be Fit number 4 Health. She has an icon on there. It's so that it'll take you directly to her link on her website. And if you're a medical professional, I suggest you do that, because you will be able to get a hold of her directly, or you get a hold of me and I'll send you over to her somehow, some way. But all I can say is that, this is not only now, but it's also the way of the future when it comes to treating a lot of different things. I mean, I have been 15 years ago looking at something that would be more specific to the nervous system, more correlating directly to the myelin sheath, to the way the neurotransmitters work with the synapses and the way they communicated. It was, to me, to find something like this was like, it would have been great 15 years ago, because I don't think I would be much better off today. If I had found you 15 years ago, I think I would have been better off today.
That's why, yes, I agree. Because
Yeah.
the sooner the better, and going down these things, but then you wouldn't be as empathetic as you are. You may not have had this radio show.
No, it's true.
God has no coincidences,
Right,
and
right.
everything is for a reason.
Yeah.
And I am here. I am starting new collaborations as well with different therapists. I have a awesome marriage and family counselor on board for
Nice.
emotional things,
Nice.
for team building, and yes. So
Works. That's exciting.
stay
So,
tuned.
yeah, you're doing some exciting stuff with other people. You're getting a group together to try to see if you guys can do a wellness
The
type of.
calm and collective.
Yeah,
Because
that's
we're
great.
talking about those re-educational patterns and how we can form those teams for individuals that can confide in the professionals. So
Yeah,
if you're
I would
looking
say.
for life coaching and all of those things to touch on, we're here for you, and trying to create our own. Meanwhile, getting the instrument out there, getting more people to feel it, experience it, and really know. And you
That's
won't
great.
know it till you try it. You have
Well,
nothing to lose.
That's it, folks. She put it all together in the one little sentence. I gotta say, this has been great, Kelly. I appreciate you being here and sharing with us and educating us. And like another great show. It ran. How did time go by so quick? It sucks. All right,
Energy.
guys. Energy. All right, guys. Have a great rest of your day. I want to say thank you for joining me again. And check my website, Be Fit for Health. And if you have any questions, contact me there. I thank you for your time. Be safe. Be healthy. Take care of each other. Aloha.
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 Mahalo.